Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering valvular diseases. Guys, if you haven't done so already, please don't forget to like and subscribe below. And don't forget, I'm on Instagram and I'm on TikTok now. My handle's the same, it's Nexus Nursing, so make sure you guys go check me out on those other platforms. The content that I provide on TikTok is different than the content I provide here on YouTube. So if you want that extra studying time, go ahead and lock me in on Instagram and on TikTok. So without any further ado, guys, let's get started. First question. A client's being seen in the clinic to rule out mitral valve stenosis. Which assessment data would be most significant? 1, the client complains of shortness of breath when walking. 2, the client has jugular vein distension and 3+ pedal edema. 3, the client complains of chest pain after eating a large meal. Or 4, the client's liver is enlarged and the abdomen is edematous. And the correct answer, guys, is 1. The client complains of shortness of breath when walking. So first of all, you guys have to understand what mitral valve stenosis is. And what that is narrowing of that mitral valve. So that means less blood, less oxygen, vitamins, and nutrients are getting into the systemic circulation. Okay, remember, this is oxygenized blood. So our answer number 1, they complain of shortness of breath, when walking. Well, shortness of breath and dyspnea upon exertion, those are like the first classic signs of mitral valve stenosis. Okay, those are the very first signs that we see. Anything that causes the patient to exert energy, which means they would need more oxygen, we see the shortness of breath. We see that dyspnea upon exertion. Now let's look at our wrong answer choices. We have 2. Client has jugular vein distension and 3+ edema. We see that more in right-sided heart failure, okay? And yes, we can see this in valvular stenosis, but this is when the valvular stenosis has gotten really, really bad. But the question is asking us what would be the most significant finding. And so it's not going to be that. It's going to be the shortness of breath and that dyspnea upon exertion, like I told you. Choice 2, you see that more in right-sided heart failure. 3, the client complains of chest pain after a large meal. That sounds more like GERD to me. After they have that large meal, they got that chest pain because of what? They got, esophageal reflux. Okay, so that's what's killing them. Number 4, the client's liver is enlarged and the abdomen is edematous. Again, that is a late sign of right-sided heart failure. Now, you see number 4, we can see that in mitral valve stenosis, but that is a late clinical sign. That's not going to be the most significant sign to let us know that mitral valve stenosis is what's happening to the client. What's going to be most significant for us to know that mitral valve stenosis is what's happening to the client is number 1, when that client is having shortness of breath or anything that requires energy or activity, they have difficulty breathing, okay? Next question. Which assessment data would the nurse expect to auscultate in the client diagnosed with mitral valve insufficiency? 1, a loud S1, S2 split and mitral valve opening snap. 2, a hollow cystic murmur heard best at the cardiac apex. 3, a mid-systolic ejection click or murmur heard at the base. Or 4, a high-pitched sound heard at the third intercostal space. And guys, the correct answer is 2, a hollow cystic murmur heard best at the cardiac apex. So you guys have to understand what mitral valve insufficiency is. Now, mitral valve insufficiency is failure of those valves to close all the way. So when those valves don't close all the way, that oxygenated blood that already got to the left ventricle, some of it retrogrades and goes back up to that atrium, to that left atrium. Okay, this is a problem because remember, this is oxygenated blood that's supposed to be going to the body. But because those leaflets aren't closing all the way like they're supposed to, some of that blood that went to the guys, I cannot speak today. Ventricle has retrograded and gone back up to the atrium. Okay, that's the problem in mitral valve insufficiency. So we're going to hear that hollow systolic murmur. So let's look at our wrong answer choices. 1, the loud S1, S2 split in the mitral opening snap. We see this in mitral valve stenosis. Remember, guys, stenosis is the narrowing, okay, not insufficient closure. So choice answer 1, we see this in mitral valve stenosis. Choice 3, mid-systolic ejection click or murmur. We see this in mitral valve prolapse, or I should say we hear this because we hear it, we don't see it. We hear this in mitral valve prolapse. And then choice 4, a high-pitched sound heard at the third left intercostal space. We tend to hear this with aortic regurgitation. All right, so for this question that involves mitral valve insufficiency, the correct answer is number 2. A client has mechanical valve replacement. Which behavior by the client indicates the need for more teaching? 1, the client takes prophylactic antibiotics. 2, the client uses a soft bristle toothbrush. 3, the client takes an enteric-coated aspirin daily. Or 4, the client alternates rest with activity. And the correct answer, guys, is 3, the client takes an enteric-coated aspirin daily. Let's talk about this and why would this need further teaching? Because remember, whenever a question asks you what needs further teaching, what needs clarification, what would you question, what they're really asking you is which one's the wrong answer choice. And for this question, number 3 is the wrong answer choice. And here's why. I need you to understand. If you go back to the question, it says that the client has just received a mechanical valve replacement. If you've been following me for any amount of time, you know that I teach you this all the time. Whenever you get a foreign object placed inside of your body, such as a mechanical valve replacement, what does bacteria love to do? Clump at that site where that foreign body is. What does blood like to do? Clump at that site where that foreign body is. So this patient is at high risk for clots. So any patient that has a mechanical valve replacement, they're going to be on anticoagulants. So a patient who is already on anticoagulants, should they be taking aspirin daily? Absolutely not. They should not be taking aspirin or NSAIDs daily because it's going to increase their risk of bleeding. It's going to mess with the effect of the anticoagulants that they're already on because of that foreign object that's been placed inside of the patient's body. All of the other teachings are good. 1, taking prophylactic antibiotics. Absolutely. If that patient's going to have an invasive procedure, such as a dental procedure, they're going to take antibiotics beforehand because anything that's invasive that can possibly introduce bacteria, that bacteria is going to want to travel immediately to the site of where that foreign object is, which is that heart valve. So the patient is going to take that prophylactically. Choice 2, soft bristle toothbrush. Absolutely, because this patient's on anticoagulants. We don't want them to cut themselves where they can bleed out. Choice 4, the client rests with activity. Of course, that's a wonderful answer. We want them to rest. Why? We want that heart to rest. That heart just went through trauma of an invasive procedure. So we want to decrease the workload on the heart. So the correct answer is 3 because 3 is the wrong choice. Next question. The nurse is teaching a class on valve replacements. Which statement identifies the disadvantage of having a biological tissue valve replacement? 1, the client must take lifetime anticoagulant therapy. 2, the client's infections are easier to treat. 3, there's a low incidence of thromboembolism. 4, the valve has to be replaced frequently. I'm sorry, guys. I have allergies in my studio. I don't know what is it that's in here, but it causes my nose to run. Okay, guys, and the correct answer is 4, the valve has to be replaced frequently. So that's a disadvantage of having a biological tissue valve replacement. Okay, why? They deteriorate. It's biological. So it's going to deteriorate. So it's going to have to be replaced frequently. Now, let's look at our other answer choices. You have 1, the client must take lifetime anticoagulant therapy. No, they don't. You have to do this for mechanical valve replacements, not biological. Choice 2, The client's infections are easier to treat. That's true. The client's infections are easier to treat, but look at the question. The question is asking us for a disadvantage, not an advantage. And the fact that infections are easier to treat with biological, that's an advantage, not a disadvantage. So that's why we didn't choose that. 3, there's a low incidence of thromboembolism. That is true. When it comes to the biological agents, the risk of blood clots significantly declines. So that's an advantage, not a disadvantage. So that's why our correct answer is 4. Which signs and symptoms should the nurse assess in any client who has long-term valvular heart disease? Select all that applies. Now, you guys know how we treat select all that applies as true or false. 1, paroxysmal nocturnal dyspnea. Absolutely. This is true. What happens? That patient has a sudden shortness of breath, and it usually happens at nighttime. Why? Because they're lying down. The position. These types of patients, guys, have to sit up or be standing in order to breathe comfortably. So 1 is true. Choice 2, orthopnea. Absolutely. And I just gave you guys the answer to that, but absolutely. This patient can't lie down. The minute that they lie down, they start having difficulty breathing. They have to be sitting up or standing up. Choice 3, cough. Absolutely. As soon as that person starts to do anything that requires oxygen, such as walking or anything that they're exerting themselves, they'll start to cough or have difficulty breathing. They'll have dyspnea on exertion. Absolutely. So 1, 2, and 3, absolutely. Choice 4, pericardial friction rub. No. We see that in pericarditis. So that's false. Choice 5, pulsus paradoxus. No. We see that in cardiac tamponade. So that's false. So for this question, our answer is 1, 2, and 3. The client is being evaluated for valvular heart disease. Which information would be most significant? 1, the client has a history of coronary artery disease. 2, there's a family history of valvular heart disease. 3, the client has a history of smoking for 10 years. Or 4, the client has a history of rheumatic heart disease. And guys, the correct answer is 4. Rheumatic heart disease is the #1 cause of valvular disease. So that would be our most significant finding in that patient's history, number 4. The client who has just had a percutaneous balloon valvuloplasty is in recovery room. Which intervention should the recovery room nurse implement? 1, assess the client's chest tube output. 2, monitor the client's chest drainage. 3, evaluate the client's endotracheal lip line. Or 4, keep the client's affected leg straight. And guys, the correct answer is 4. You want to keep the affected leg straight. Remember, guys, that catheter is being inserted through the femoral artery. So we want to keep that affected leg straight because we don't want them hemorrhaging. Okay? Choice 1, 2, and 3 is not necessary because the patient's not having open heart surgery. All right? So they don't need an endotracheal tube. They don't need a chest tube. And what dressing? So the correct answer is 4. The client with a mechanical valve replacement asks the nurse, "Why do I have to take antibiotics before getting my teeth cleaned?" Which response by the nurse is most appropriate? I think I gave you guys the answer to this already. 1, you're at risk for developing an infection in your heart. 2, your teeth will not bleed as much if you have antibiotics. 3, the procedure may cause your valve to malfunction. Or 4, antibiotics will prevent vegetative growth on your valves. And the correct answer is 1. You're at risk for developing infection in your heart because Anything that's invasive, there's a chance of introducing bacteria, and that bacteria is going to go immediately to the location where that foreign body is. In this circumstance, it would be that valve, that heart valve. Now, number 4 is true. It'll help prevent vegetative growth, but remember, you're speaking to a lay person, so you don't want to use that type of terminology where they don't know what that means. They'll think you're talking about vegetables. So number 1 is accurate, and that is you're speaking in the language and in the way that the patient can understand. So that's why number 1 is the answer and not number 4. The client had open heart surgery to replace the mitral valve. Which intervention should the ICU nurse implement? 1, restrict the client's fluids as ordered. 2, keep the client in a supine position. 3, maintain the O2 sat at 90%. 4, monitor the parental nutrition. And the correct answer is 1, guys. You want to restrict the client's fluids as ordered. Why? You want to decrease that workload of the heart. This was very traumatizing. That heart just had invasive procedure on it, right? So that heart needs to rest. We don't want to push more fluids where the heart has to push out even more blood to the body. We want to rest the heart. We want to decrease the oxygen demands placed on the heart. So that's why number 1 is the correct answer. Now let's look at our wrong answer choices. Number 2, keep the client in a supine position. Did I not just tell you that lower that the patient's lying down, the harder it's going to be for them to breathe? They need to be sitting up or standing up. So why are we going to put them in a supine position? No, that's wrong. Choice 3, maintain their oxygen sat at 90%. No, we want that oxygen, preferably we want it 98 to 100, but we'll keep it if it's 95 to 100. Some books, guys, say 94 and 93, but most textbooks, the ones I teach out of, we keep it at 95 because we want to be more conservative. So just check your textbook. There might be a variation in 1 or 2%, but 90 is way too low. Once a patient hits 90, they're in respiratory distress. Okay, that's not good. Choice 4, monitor the total parental nutrition. Why is this patient going to be on TPN? They don't have a GI disorder. You know, they're not malnourished. There's nothing in this question that says anything about malnourishment or them having a GI disorder where TPN would be necessary. So that's false. Number 1 is the correct answer. Which client would the nurse suspect as having a mitral valve prolapse? 1, a 60-year-old female with CHF. 2, a 23-year-old male with Marfan syndrome. 3, an 80-year-old male with AFib. Or 4, a 33-year-old female with Down syndrome. Okay, guys, and the correct answer is 2, the 23-year-old male, and this is your key, guys, with Marfan syndrome. Marfan syndrome, that's the key. They tend to have these life-threatening issues like the mitral valve prolapse and multiple aneurysms that can rupture at any time. So that patient with Marfan syndrome is the one that's most likely to have this, okay? The charge nurse is making shift assignments. Which client would be most appropriate for the charge nurse to assign to a new graduate who just completed orientation to the medical floor? 1, the client admitted for diagnostic tests to rule out valvular heart disease. 2, the client 3 days post-op MI being discharged home tomorrow. 3, the client exhibiting SVT on tele. 4, the client diagnosed with AFib who has an INR of 5. And guys, the correct answer is 2. This patient, they had an MI, but the MI was 3 days ago, and they're being discharged home tomorrow. So this is the most stable patient. Whenever they ask you, who are you going to give to the nursing student? Who are you going to give to the new graduate nurse? Who are you going to give to the nurse that just is floating to your unit for the day? What they're really asking you is, who's the most stable patient? And in this situation, that patient who had the MI 3 days ago and is about to be discharged tomorrow, they are the most stable patient. Notice I said discharged tomorrow. Why? Any patient that's going to be discharged, you need an experienced nurse. Why? Because along with that discharge comes with a boatload of teaching, coordination of care. You're asking the doctor for referrals, for home health, for occupational therapy, for physical, for everything under the sun that you know your patient needs. So you have to know your stuff like the back of your hand. So I want you to know this. It said discharge tomorrow. So we know the patient's stable and they're not being discharged right away, so we can give it to the new graduate. Now let's look at our wrong choices. 1, the client admitted for diagnostic tests to rule out valvular heart disease. Guys, whenever you see something says rule out, that means this is what we think they have, but we're not sure. So we want to rule it out. So we're not going to give that to a new grad. We don't even know what's wrong with the patient. Why would we give that to the new grad? When we have a patient and we have to rule something out, that means we're not sure what it is. We think we know, but we're not sure. So we need an experienced nurse on that case. Why? Because they have to be assessing that patient very closely, and they can tell the telltale signs if something's going on in order to call the doctor right away. So that patient is not the most stable patient. Choice 3, the client exhibiting SVT. Absolutely not. They're not stable. And number 4, the client diagnosed with AFib. Look at that INR. That INR is 5. That patient's bleeding all over the place. They're not stable. So the most stable patient is number 2. The tele nurse is unable to read the tele monitor at the nurse's station. Which intervention should the tele nurse implement first? 1, go to the client's room to check on the client. 2, instruct the primary nurse to assess the client. 3, contact the client on the call system. Or 4, request the nursing assistant to take the crash cart to the client's room. And the correct answer, guys, is 3, contact the client on the call system. While you're there at the nurse's station, buzz their room. Mr. Such and Such, are you okay? Yes, I'm fine. I just went to the bathroom. I'm reconnecting myself right now. Mr. Such and Such, are you okay? Dead silence. You don't hear anything. Then the next thing you're going to do is send a nurse to the client's room. Why? You are the tele nurse. You're at the station. You can't leave the other monitors. You go check on that patient where something's happening on another patient and nobody was there to see that monitor. Nobody was there to call a code to get that crash cart going. So you can't leave. So the first thing, and let's say you sent a nurse to go check on the patient. The reason that's not your first thing is because the time it takes that nurse to go check on the patient, you could have just buzzed that patient's room. So your first reaction is to buzz that patient's room. No answer, you send another nurse out, okay? So let's look at our wrong answer choices. 1, go to the client's room to check on the client. You can't leave those monitors alone, so that's wrong. 2, instruct the primary nurse to assess the client. Yes, after you buzzed them and you didn't get anything. Choice 4, request a nursing assistant. How are you going to request a crash cart and you don't even know what's going on with the client? You don't know if they're coding or not. That makes no sense, okay? Next question. The client shows VFib on tele at the nurse's station. Which action should the tele nurse implement first? 1, administer epinephrine IV push. 2, prepare to defibrillate the client. 3, call a stat code. Or 4, start CPR. And guys, the correct answer is 3, call a stat code. Remember, you're the tele nurse. You can't leave that station. So when you look on the monitor and you see VFib, the first thing you're going to do is call that code. You call that code, and you calling that code gets the ball rolling. So you're getting that crash cart and all the equipment needed for that patient to the room. Everybody's running to that patient's room, and whoever gets there first is going to start CPR, right? But the first thing you're going to do is to call it. Let's look at our wrong answer choices. 1, administer epinephrine IV push. That is not the first thing you're doing. And how are you doing that when you're over at the nurse's station and you cannot leave the monitors? Choice 2, prepare to defibrillate the patient. You're not going to do that first. You are at the station. You're going to call the code first. Choice 3, yes, you're going to call the stat code. And then 4, start CPR. Whoever gets there first at that patient's bedside is going to start CPR. The client is experiencing multifocal premature ventricular contractions. Which antidysrhythmic medication would the nurse expect the healthcare provider to order for this client? 1, lidocaine, 2, atropine, 3, digoxin, or 4, adenosine? Okay, guys, and the correct answer is 1, lidocaine. So, guys, lidocaine, this is the drug of choice for ventricular dysrhythmias. Let me repeat that again because you need to know this. Lidocaine is the drug of choice for ventricular dysrhythmias. Choice number 2, atropine. That's the drug of choice for asystole. Choice number 3, digoxin. That's the drug of choice for AFib. And then we have choice number 4, adenosine. That's the drug of choice for when the patient's having supraventricular tachycardia, SVT. Okay? Oh my goodness, guys. And we're already down to our last question. The client is exhibiting sinus bradycardia. They're complaining of syncope and weakness, and they have a blood pressure of 98/60. Which collaborative treatment should the nurse anticipate being ordered? Being implemented, excuse me. 1, administer a thrombolytic medication. 2, assess the client's cardiovascular status. 3, prepare for insertion of a pacemaker. 4, obtain a permit for synchronized cardioversion. And the correct answer, guys, is 3, prepare for insertion of a pacemaker. So what happens, guys, is whenever that patient's pulse gets below whatever that set number is that the surgeon and the cardiologist and the whole team decide on, whenever it gets at that point, the pacemaker kicks in. Okay, so it's set so the patient's heart rate never goes below 60, or it never goes below 65 or 62, whatever that rate is. So the correct answer for this is prepare insertion of a pacemaker. Guys, I hope this video was helpful to you. Someone in the comments told me that they were struggling so much with valvular disorders, so this is for you, Sarah. I hope you guys found this video helpful. If there's anything you'd like to see me cover that I have not already, please leave me a note in the comment section. If you follow me on TikTok, leave me a comment on TikTok too. If there's something you want me to cover, I'll make a video for you real quick, part 1, 2, and 3 if necessary. Guys, please don't forget to like and subscribe below. Don't forget to check out my TikTok and Instagram. The handle's still the same. Next is nursing, and I'll see you on the next video.